perhaps the first of the kind in Uganda, when the president had his blood drawn publicly to be tested for HIV on the 8th of November last year. This was to draw attention to the need for counseling and testing in the fight against HIV/AIDS in the country. But barely 2 months since the campaign was launched, civil society organizations under the umbrella organization Uganda Coalition for the Access to Essential Medicines released a survey carried out in over 60 health centers and hospitals across the country. Nearly all lacked HIV testing kits, with some only reserving the kits for eradication of mother-to-child transmission. Members of the CSOs claim the kits have been out of stock since September last year.
Even those that have limited stocks, they were under strict instructions to strictly use it for EMTCT services only. And they even projected that these stocks most often said would last, say, 3 weeks, in the 1 month, in the next 2 weeks.
NMS spokesperson Dan Kimosho says there has never been any gaps in the supply of kits to the health centers. He claims the kits are stolen by the health workers.
The challenge that we have encountered in supplying of these test kits is that they are being stolen. Every day you'll find a complaint about the stolen test kits. Police has been investigating. Some people were arrested.
Officials from the Ministry of Health confirmed the stockouts, but quickly added that they have sought assistance from partner organizations to resolve the crisis.
But through partners also, we've mobilized over 1.8 million kits, tests worth, about 18,000 kits that we are already in the process of getting moved to the facilities.
The situation is threatening the current progress Uganda has scored in fighting new infections. In 2011-2012, the Uganda AIDS Commission reported 140,000 new infections compared to the 160,000 infections registered in 2010-2011, which implies Uganda had reduced new infections by 20,000 in just 1 year. HIV counseling and testing is the first step to enrollment on the ART program and is important in the HIV epidemic response as it contributes hugely to knowing the number of infected persons to be initiated on care and treatment. The activists anticipate that at least 15 million people should have tested by 2014. Irene Namialo, NTV.